Hi, I'm Dr. Alex Jantz from the Alternative Healthcare Center here in Grosse Pointe Woods, Michigan, and I wanted to briefly talk to you about the importance of orthotics. Now, if you're not kind of uncertain of what orthotics are, it's basically a foot support that we put in the bottom of your shoe to kind of balance out the entire skeletal system. So when I explain orthotics to my patients, I always talk about the feet being the foundation of the body. Think of it like a foundation to a house. If you have a poor foundation of the house, you're probably going to run into some issues, in the future, some structural issues, and that's the same thing with our feet. So when we speak to the foundation of our feet, if we don't have a proper foundation, it can create a cascade effect up the body. We can start running into things like knee issues, hip pain, and then most importantly, low back pain as well. So the first thing that I check on people when they come in for a low back pain is their feet. And a lot of times what happens is the arches in our feet start to collapse. Now, Michelle, if you could stand up for me real quick, I'll kind of quickly explain what I'm talking about here. So a lot of people, they go through a process which is called hyperpronation. And that means that they lose this medial arch on the foot here, and their foot starts to roll in like this. So every time they're walking, you got to remember our feet are our main shock absorbers of the body. So when you're walking, your feet should be absorbing that shock and not putting it on the knees, the hips, and the low back. Now, when we become flat-footed and hyperpronate like I'm talking about, we lose that arch, and then as a result, the knees start to internally rotate like this, and then it creates a cascade effect going up into the hip where this hip will drop down. And then if you turn around, Michelle, when you're walking, your low back starts to get torqued every time you walk. This is a main issue that I find with my patients that aren't addressed normally. So what we do is, you can turn back around for me, is we're trying to regain that medial arch in the foot. And how we do that is we take 17 different measurements on a 3D scanner. With those measurements, we're allowed to see if our patient is in fact a candidate for orthotics. And if they are, what I do is I take a custom mold here from a company that we work with in New Jersey, and we actually cast your feet in this material here. So once we cast your feet, we send this out to the company, and they make a specific custom mold for you. That way, when you're walking, we regain these arches in the feet. It takes pressure off the knee joints, allows the hips to move as they should, and then it doesn't torque that low back when you're walking. So it's a really important point that I stress with all of my patients, to make sure that we have a good foundation in our feet so that we're not running into issues like knee pain, hip pain, and especially low back pain. We do orthotics in our office. If you want to come in, I do a free consultation to see if you are in fact a candidate. And if you are, we can go ahead and get you set up that day. So come on down to the Alternative Healthcare Center, and I'll be more than happy to take care of you. Have a great day.